Hi, this is Dr. Ty Vincent again. Low dose immunotherapy videos. This one is going to be about a flare response. This is a really important video. I hope it's clear and understandable because if you think that a dose makes you worse, meaning that the dilution was too strong, it would mean that the antigen was correct, but the dilution was too strong. So it's good information if somebody truly does have an overdose response. It would tell us that the antigen is correct. And that's actually really vital for us to know. And it's good news. It means that we should be able to fix you. It's like anytime we truly overdose and a person have a flare response, it means that we can use that same antigen to fix you. You can't really have one without the other. So it's not a terrible thing if we overdose people. In the long run, it's good news. The vast majority of the time, people tell me they think the dose was too strong or they had a flare response. They didn't. It was some other explanation. So I'm going to give you some things to think about in terms of what sounds like a legitimate overdose flare from LDI and what probably isn't. And it's not clear a lot of the time, so we just make our best decision, based on what information we have. So let me tell you a few concrete things, okay? Having done this therapy for 15 years now, I have a much better handle on what a true overdose response sounds like. For years, anytime somebody thought that they got worse, I just took it to heart and said, okay, well, let's back up, wait 7 weeks, try a weaker dilution. And that's a big hassle, and you end up wasting about 3 months of time every time you do that. So I've gotten a lot better over the years at avoiding unnecessary stops and backing up. What I can tell you is that a real overdose flare from LDI will occur within 48 hours of the dose. So if you take a dose that's too strong, let's say you're treating arthritis or something, Lyme disease or some other kind of arthritis, your symptoms that are related to the antigen will get worse within the first 48 hours after taking the dose. So if you think your symptoms started to get worse 3 or 4 days later, it's not related to the dose. It was caused by something else. That's a good, clear breakpoint for us to think about. The symptoms should get worse abruptly, not really gradually, and they should not have already been getting worse before the dose. Sometimes people will tell me, the dose made me worse, I just got worse and worse, and then when I say, well, when did you first start to feel worse? They'll go like, well, the day before the dose, I was starting to get worse. Well, then of course the dose didn't cause that, and what we don't know is whether it got more worse after the dose or not. It can be kind of hazy, but that timing is really, really key. So if you will write down when you take your doses and when you notice symptom changes, that timing factor is really, really critically important. That's true for dose reporting in general as well. So the other thing is that your symptoms need to get worse than you have seen before. One of the characteristic things of immunological problems is that they fluctuate a lot. So your immune system will fluctuate in terms of its reactivity and intensity depending on how much sleep you got, how stressed you are, what you're eating, whether you have a viral infection, a whole host of different things, where you are in your menstrual cycle. If you're a female, a lot of these things will influence your symptoms on a day-to-day basis. So you have to have some kind of sense or awareness of your range of symptoms, your bad days and your good days and everywhere in between. And for you to decide that a dose really flared you, your symptoms need to get sort of worse than ever, okay? Like worse than your worst days. And they need to stay that way for a sustained amount of time. So sometimes people will tell me, oh, I was really worse for a couple of days, and then I was better for a couple of days, and then I was worse again for a couple of days, and that means the dose didn't do anything. If it really makes you worse, you're gonna get worse and stay that way for a sustained amount of time that's generally gonna be a week or longer. So if you just have a couple of worsened days, bad days, and you're not super sure that they're worse than ever, it's probably nothing, and we should just keep plugging along through stronger dilutions. We don't wanna waste 3 months of time if we don't have to. This can be difficult for people because most symptoms you have are not measurable, they're not objective, they're purely subjective. So it's hard, and I totally appreciate that. And if we're not sure, we can just err on the side of caution, and we can wait 7 weeks to reset your immune system and then start back at a weaker dilution. That's one of the odd things about LDI, is that if we do overdose you, you have to do this 7-week waiting period, and then the immune system is reset and we can start over. You can't take another dose of that same antigen within the following 6 weeks, or you might just add to the problem. And so that creates a hassle. Whenever you send me a dose report, I'm gonna have a dialogue with you back and forth, and I'm gonna tell you what I think and what you might wanna do, and then we'll make a decision together about how you're gonna proceed. But people thinking that their symptoms worsened and they flared, that's a common thing that'll just kind of delay progress. And so I will probably ask you these sort of specific things, like when exactly did the worsening occur? How can you gauge that it was worse than you ever have seen before? or in some, whatever the best of your ability, how you're going to describe that to me. I will pin you down on those things so I can decide whether we really should back up or whether we should just kind of lean forward and keep on going through. If you have allergies, you will have to be exposed to the allergen in order to determine whether the dose was too strong or too weak. So if it's a food allergy and it's a food that you're avoiding successfully, you won't have any idea that the LDI dose was too strong until you also eat the food. You have to do your test exposure. Or if it's chemical sensitivity or some other thing where you have been successfully avoiding it, you're gonna have to do your test exposure, so you're not gonna know within the first 48 hours that the dose was too strong. This is a different circumstance. You're gonna do your test exposure at 1 week, and then you're gonna tell me, oh wow, I think it was worse because instead of a stomach ache and nausea when I ate carrots, I actually threw up. And then I felt horrible all day. Like, okay, well that's worse than your usual, right? So you wanna see something like that that convinces you that the symptom response was worse than normal. And it can be challenging. With environmental allergies, a lot of times people are exposed all the time. Like if it's mold or if it's pollen in the air, you may have constant symptoms all the time because the exposure is constant. And in that case, you will probably see your symptoms just get aggravated within the first 48 hours like you would with any of the internal antigens. So just kind of keep that in mind, that the exposure to the antigen is one element that has to be present for you to have this negative response. When we're treating things internally, like any kind of internal microbe that we use for autoimmune disorders, or for the collagen we use for arthritis, or the Lyme disease mixture, other kinds of organisms, those are already in you all the time, so there is no exposure challenge, and those are the instances where your symptoms will just get worse, like spontaneously and abruptly and dramatically worse within the first 48 hours. So that's what you're looking for. If you're not sure, just give me whatever information you can that makes you wonder whether this might be a flare or not, and I'll try to help you sort it out, and we'll just try to make the best decision we can and figure things out as efficiently as possible without wasting time if we can help it.